Another hospital in Hamilton is running into problems, but this time it's impacting the youngest patients. McMaster Children's Hospital is facing a surgical backlog with some waiting on the list well past the ideal window of treatment time. Simone Gavro spoke with the hospital today to get an idea of what the situation is like. Simone, what more can you tell us?
Hi, Adam. Yes, McMaster Children's Hospital says that as of May, there's about 2,400 children on the waiting list waiting for surgeries, and doctors are concerned that there's no relief in sight.
It's completely horrible. The backlog is worse than I think anybody could ever predict it.
Here at McMaster Children's Hospital, some of Hamilton's youngest patients are waiting far too long for surgeries.
The population's growing and the system didn't grow with it. We then have the pandemic. We had the triple threat. And I think the other thing is a lot of people that weren't being seen during our pandemic years are now being seen. It's overwhelming.
Over 2,400 kids remain on the waiting list here at the hospital, and about 63% of those patients have passed the recommended wait time for operations. But some kids haven't even made it on the wait list yet and are still waiting to see pediatric specialists.
We really thought at this point it would be taking kids off the wait list, and every month we're putting more on. And I think that's the most stressful part of it. Is it's hard to see an end to this.
Staffing shortages across the hospital system are contributing to the backlog, specifically with nurses.
I'm not surprised about what's happening in children's hospitals.
The RNAO has been seeing this across the province and says the nursing shortage is just one piece of the problem.
The children, in terms of sufficient funding for programs related to children, whether it's surgical, whether it is community care, whether it's home care, are absolutely deficient in terms of the funding that they get from government.
The province says it's spending $330 million a year on children's health care across Ontario. Hamilton Health Sciences is calling this a historic investment and will help free up beds in the hospital and help fund its same-day overnight unit. But Peterson is worried this won't be enough.
Ramping up our ambulatory clinics, getting more bodies, we have X number of money, but when you look at the list, it's X number of dollars plus one or two. For my, nurses, allied health, the problem is we're always lean.
Peterson understands this is a difficult time for parents, but encourages them to be patient and advocate for change. And on top of the surgical backlog, there's about 2,000 children waiting to be seen by specialists at the hospital's developmental pediatric and rehabilitation program. 1,200 patients are added to the list every year, but the hospital's resources only allow them to treat 750 patients annually.